You're watching Let's Chat.
It's so great to have with me on the show today Summit Physical Therapy, Kevin Costa, co-owner of this great physical therapy clinic that serves Chattanooga and surrounding areas. Thanks for coming on the show, Kevin.
Absolutely. Thanks for having me.
So today we're talking about shoulder and low back pain. Talk to me about the symptoms you see sufferers experience.
A lot of the common symptoms that I would see when a patient comes in is something that's called sciatica, kind of a general layman's term. Sciatica's typically referred to as pain or numbness that comes down the leg. It can cause weakness, it can cause irritation in the leg and in the low back, and sometimes we'll notice just specific pain in the low back area. It's usually from like a muscle spasm that is trying to protect that joint. We do see a lot of shoulder patients, and so some of the common symptoms of shoulder pain is you'll get some referred pain coming down the side of your arm, and patients will have difficulty reaching up overhead, out to the side. They'll have weakness, and then sometimes they'll even have a hard time reaching behind their back.
What causes this? Is this like injury or is this genetic, age?
Yeah, well, I wouldn't say it's genetic by any means.
Okay.
Typically, it's just the wear and tear that we put on our bodies. So if we're referring to low back pain, it could be from like improper lifting mechanics. It could be just your age. As you start to age, the discs start to lose the water in them. So the vertebrae get closer and closer, and there's not enough room for the nerves to fit through those holes. And so when the bone touches one of those nerves, you get that sciatica complaint that I was talking about.
Right.
So you could have discs pushing up against those nerves, and you could even have what I talked about earlier, where the SI joint, that sacroiliac joint, is not necessarily in the right position. So we have to do some specific techniques for that. If we go back to the shoulder, it could be posture. A lot of people are now on their phones, right? We do a lot of things in front of us. If it's either driving or on the computer, they'll end up getting what's called a tight posterior capsule. So they lack that range of motion to go behind their back or across their chest. You could even have tingling and numbness coming from the arm as well. That usually signifies some type of nerve issue going on.
I would bet for treatment and prevention, it's very important to understand what caused it. As a very happy patient of yours, and you really helping me the months I did with treatment for my low back pain, I would say all but cured. I know that's a big word to use. I've been very happy. Talk to me about ways you treated. I could share how you treated me, but what's a typical treatment program look like for low back pain and shoulder?
Well, we have to find the right diagnosis. We have to find the root cause, because if we don't do the right thing and we're doing the wrong thing, you're not going to get better, or it could even actually make it worse. So we have to determine, is it a disc? Is it the lack of the disc height, that disc degeneration? When it comes to the shoulder, the same thing. We need to check that range of motion first and foremost. We need to check that strength, and we need to do some special tests to figure out what is actually causing that issue. Once we find the root cause, then we can get deeper into the treatments. Does it need to be a specific movement? Does it need to be some muscle energy techniques like we used? Does it need to be postural awareness? Does it need to be strengthening? Does it need to be stabilization? Depending upon what's going on, that tells me everything that I need to do.
Well, I found you all creative. I thought the program was intense in the best ways. It was private. Those are why I chose to work with, to get help from you all. How can we contact you? How can our viewers get a hold of you?
Yeah, absolutely. They can give us a call, 423-777-4974. They can find us on our website, summit-therapy.com. Oftentimes, you do not even need a referral, so you can just give us a call, reach out to us on our website, and get in touch with us.
Thank you for coming on, Kevin.
Absolutely.
Summit-therapy.com. Look them up. Lots of locations around the surrounding areas and wonderful treatment. I speak to it from experience. Thanks again for coming on.